DCD remains an enigma in our country. So whenever you are in a DCD situation, the same doubts will arise every time. Is it legal? What is the documentation that you have to do? How will the organs remain viable? Can we use machine perfusion? Should we go for normothermic regional perfusion? How do you determine whether your kidney, pancreas, liver, lungs, heart, are they fit for transplant? So all these doubts will keep coming in your mind. This one-day certified course by IMMAST, which is endorsed by the Liver Transplant Society and the Indian Society of Organ Transplant, will get you everything under one roof. It's a structured, consolidated course with the most experienced faculty in the country, and it's a hands-on, step-by-step training on a porcine model. So with a case-based interactive discussion, you get more in one day what you would possibly pick up maybe in 6 months to 1 year. So we'll be covering for you the various categories of DCD as applicable to India in a very step-by-step approach, both the uncontrolled and controlled DCDs. We will tell you how to do DCD in a brain death situation, which is DCD4. We can learn about futility of care, withdrawal of life support, and how you move from WLST to the DCD-NRP interface. And we will be sharing this experience for the first time on how exactly one has to do step by step. What is the equipment that you need for this whole thing to be successful? So it's a great opportunity out there to jump onto the DCD wagon and get a head start.